Welcome back. 433 coronavirus cases, out of which 402 are active. We have lost 8 lives in our country so far and are currently staring at a situation with 23 states and union territories in a state of a complete lockdown. Numbers enough to explain the gravity of the situation in our country, with cases now increasing now at a faster pace. Let me tell you where we stand as far as the coronavirus threat is concerned. India so far has crossed stage 1. Stage 1 is when the cases are mostly those that are coming in from outside, the international travel passengers who get infected elsewhere and then come to our country, and then it gets detected here. We are actually past that stage into stage 2. Stage 2 is when infection begins to spread from positive cases that came from outside the country to others in our country. The big concern is if we will reach stage 3. The big intention is to not reach stage 3, though many believe it's perhaps inevitable. This is when the disease spreads within the community, in your localized areas. It starts affecting large areas with high number of cases coming out from these pockets. The stage 4 is the one we hope we never reach, when the ongoing transmission has no endpoint, like what we are seeing in Italy or what we saw in China. Now, how do we ensure that we don't get into a worse situation than where we are today? What should be the top priority for the government in India? Now, here are some of the things that our team has put together. Our experts will, of course, add to this. But 5 things that we believe the centre and state should look at right now is, firstly, to expand the number of testing facilities. Also relook and keep relooking at the criteria for testing. In the initial days, it was a big concern because we were only testing people who had an international travel history. And it was only later that we updated that to say, okay, what if you live here, but you've been in contact with somebody and now you may have the infection? So that criteria needs to keep updating it. That needs to be expanded. Point number 2, we need to add to the existing health infrastructure, keeping in mind what happens when we reach the next stage. And some of our guests in the previous conversation were just talking about it, how the cases are increasing. And if we reach the point where you have hundreds and thousands, are we ready health infrastructure-wise? ICU units, ventilators, health staff, beds, hospitals. What's the plan there? This is the most essential part. Of course, what we have to continue with is aggressive tracing of the super spreaders. If somebody has tested positive and has traveled a little bit and we do the contact tracing, that will now need to step up as more and more cases come out. This will become a huge challenge. Point number 4, governments need to start taking strict action against violators to send a message across to the people that if you break the rules and if you disregard social distancing and Section 144 or curfew, whatever be the rule in that area, you can be punished. If you refuse to be home quarantined when you have been told to, you can be punished. And point number 5, the plan for survival fund for those who are rendered jobless. We just broke a story about how Centre has said, as far as the contractual labor in government is concerned, they will still be paid even if they're not working right now. They will be considered on duty. But there are thousands and lakhs of those in the unorganized sector who will run out of money and will not have food to eat if this situation continues for a few weeks. And that has to be top priority for all state governments and the central government. Now, let me go across to our panelists who are joining us right now for this conversation. Dr. Rajesh Chawla, Senior Consultant for Respiratory Medicine and Critical Care at Indraprastha Apollo Hospitals. I've also got Dr. Vivek Jawli, Chairman for Cardiac Sciences and Hospital Executive Council for Fortis Hospitals from Bengaluru. Dr. Jaleel Parker, Senior Consultant with Leelavati Hospital here in Mumbai, and Dr. Jeenam Shah, Consultant Interventional Pulmonologist with Wokhard Hospital in Mumbai. Before I go across to our panelists, I just also want to let our viewers know that in just a bit from now, in Madhya Pradesh, there will be a swearing-in ceremony that will, in fact, it has begun, and Shivraj Singh Chauhan has now taken oath as the Chief Minister of Madhya Pradesh. Remember, Few days ago, a couple of days ago, Kamalnath resigned ahead of a floor test and paving way for the BJP to get back to power. And here's Shivraj Singh one more time. 18 months after he was voted out of power, he is all set to become the chief minister. He's taken oath as the chief minister. Well, so those are the visuals that we've got for you. Shivraj Singh's first job will have to be what it is for every other state government, to ensure that coronavirus doesn't spread, that norms are followed. Just a short while ago, we had visuals coming in of leaders who were going in for this ceremony, all stuffed inside one bus, completely disregarding the norms of social distancing. Let's begin with our panelists. Dr. Jaleel Parker, let me come to you first about, how is it that we prepare for the future? We've got 23 states in lockdown, but health infrastructure-wise, are we ready?
See, unfortunately, our population is a curse on our country. Because of this huge population, we do not have so many facilities. The government cannot cope up in a state of emergency, though they are trying to do their best, whether it is the central government or it is the state government. But having said that, one has to understand that our demography and our challenges are different from the other countries. For example, you have had a curfew that is going on for so many days. Most of the people who are in the jhopatpattis, their population is so huge that every jhopatpatti, every hut or every small house, there are 10 people who are staying over there. Some do day duties, some do shift night duties, etc. Now, by pushing them back into their hutman colony, I don't see that we are helping the population at large, because I think by now we are into the community spread, if I'm not mistaken, and I'm sure many of them will agree also. Number two, if you have stopped all the facilities where people, even if they are doing their daily wage earners, for example, you have the security guards or the watchmen, they cannot even have tea while they are on duty. They cannot have their dabbas which are on a monthly basis that they come. There are no fruits vendors who are available. What we are talking about on television are the people who are going into the malls, who are going to Godrej supermarket or who are going to food hall. Those are the few, but what about the people at large? I think the test that we are talking about for coronavirus, the cost is 4,500 rupees. Now you tell me, who is going to afford 4,500 rupees? For example, if the husband is there, he himself, his wife, he might be having a child or two. So 20,000 rupees, there is nobody is talking about their payment, their monthly salary. How are they going to survive? If they don't eat well, if they don't have the right nourishment, how is it that we are going to control? Now, those facilities need to be there. I understand that you need to have curfews, but at least a fruit vendor on the road, he can at least give fruits to these people, I find it very difficult that we will be able to, whether we are really doing good or we are doing harm to the population at large. So I think we should look into it. For example, fortunately now, they have started with private hospitals that they can treat and they can even diagnose. We have been very lucky. For example, the hospital in which I am, Leelavati Hospital, I think the trustees and the management has been very kind, and they have opened up nearly, I think, if I'm not mistaken, maybe 15 isolation beds, plus the intensive care, plus the screening section. So we are doing our best, but is that enough? That is the question.
Is that enough is the question. How can we make the most of it and prepare ourselves for the worst? Dr. Rajesh Chawla, if I can come to you on that. And everybody knows that India doesn't really have the best of the health infrastructures. So it's going to be a struggle for us. What is it that the governments can start looking at in terms of extra space, extra beds, basic bare necessity equipment that we may need?
Let me tell you I have handled the swine flu and H1N1 also. This is for the first time. I must say the government has done a wonderful job. Right from the Prime Minister onwards, the Health Ministry, the local chief ministers of all states, they're actively involved. And as you just heard, our country is very large. So we need to prioritize. And they are prioritizing and the advisories are changing. And right now, in most of the places where the test is available, it's free of cost. But it is not available for anybody with cough and flu. It is only when they have set advisory, those patients are tested. And since we expect with the passing time, it could go into the stage 3 and it could go into the community when we may have more. So they are preparing, even in Delhi, I know most of the hospitals, they are preparing, the wards are prepared, the special areas are being prepared. And of course, it has to be a little faster so that the kits and everything is made available to the hospital. So when they get a case, they don't have to worry and they can just start working on the same thing. But I think the government so far has done good. And I think the way they are doing, if they keep on progressing, the way the government, the Prime Minister, everybody is involved, if we could make the flat line, don't go into a large number of cases suddenly, then probably we'll have a good outcome of this disease.
Okay, of course, and I think that's why we've moved, and India is one of those countries which has moved, I believe, has moved relatively quicker when it comes to a widespread, larger lockdown. But does that mean that we've managed to contain it, or are we still looking at a situation where perhaps tomorrow we realize that it's already out there, and we've, if not the community is, level, at a localized level in many, many pockets, we have seen the spread. Dr. Shah, what should we be doing right now to prepare ourselves, not to say whether or not we've done a good or bad job, but to ensure that it doesn't become a disaster tomorrow?
So as far as I'm concerned, I already believe that we have been into stage 3 already. Just because we are not testing enough patients does not mean that we don't see community transmission. I think already the community transmission has happened. I come from an area, Mumbai, where the maximum cases are there till now. So I'm 100% sure that the community transfer has already happened. But to see the seriousness in the people's face, I don't see that too easily. So even though the measures have been imposed already, the curfew has been imposed in the state of Maharashtra, but I still see people when I go to hospitals for my emergency visits. I still see people on the roads roaming around, even for the 5 o'clock thing, that thali that has to be put. A lot of people were there on the street. So first and foremost, the people should realize that it's a scary situation. It is a situation where we need to act as soon as possible. Fortunately, we have got that 1 week where the cases are not that much as of now. So if we act right now, it's going to be very important that we don't see a sudden spurge of the cases. So as far as I understand right now, the government is taking active measures. But at the same time, the private hospitals should also start taking active measures. The public-private partnership that we talk about is not functioning as smoothly as expected. So as of now, the private hospitals only have 2 beds, 4 beds at the max. Some few places we have 10 to 15 beds. But that 2 and 4 beds for a population of crores and crores is not going to be enough. So we definitely need more number of beds. We are not just talking about the beds, we are also talking about the system that comes along with it. We need ventilators. So ventilators in a hospital are again in a severe shortage, as we have seen in Italy as well as other cities. We have seen that even ventilators have been short out there. So imagine in a situation like India, we already are a resource limited setting, and if we get those kind of spurts, we don't have the ventilators, we don't have the beds, we don't have enough personnel to work, we don't have the protective equipments available, we don't have enough number of masks. So I think that should be the priority, just to start getting all those things geared up. God forbid if we reach into a stage where we lot of transmissions, that with the time that this all preparedness would come handy. And we are not just expecting one spike, as we have seen with other diseases also. We sometimes see second spikes and third spikes also. So that doesn't mean that we have avoided the first spike, means that we are not going to have sudden spurge of cases later on. So we should be always prepared. Social distancing should be followed. It is not followed to the core as of now. So I feel those are the 2 important things that the government should be doing, is the public-private partnership and educating the masses across that please stay at home, don't venture out.
Yes. Okay. So let's begin with one of the first points, that you raised and several others also raised, which is to say, perhaps we have far more cases than we know about right now because we aren't doing enough testing. Dr. Vivek, do you believe that that has to be the first step where we expand
Yeah.
testing centers and do more random sampling to see just where we are at?
See, this is quite unmistakable that the community spread has begun, number one. Number two, we must understand that we have this much of capacity, whether for testing, for ventilators, for treating, for hospital beds, even simple things like masks. We should not be a spendthrift community right now. We have to be extremely cautious. We have to believe that we are going to the worst. Like in a war, you prepare well if you know you are going to the worst. This paper from the Imperial College says that there will be 12 lakh deaths in US, 5 lakh in UK, 35 lakhs in India. But by extrapolating very simple logistics, we think in Bangalore, I'm very proud of my government, I will come to that. In Bangalore, we think there are going to be 80,000 cases once, if this goes really bad. There will be 2,000 cases which will come down seriously, half of them requiring ventilator. My government has been extremely proactive. I'm very proud of them. The Victoria Hospital has been emptied, 1,700 beds for this Corona hospital. It will be well equipped from all, and the public-private partnership has been exemplary in my state. The Chief Minister yesterday called a meeting at 6 o'clock in the morning, everybody was there. Today the meeting was at 11 o'clock, everybody was there. And we are getting prepared, there is a good partnership, but what is important is that now everybody has to pour and chip in. The doctors, the general medicine, the ICU, the pulmonology, the anesthesia, the cardiology, the postgraduates, the nurses, the technicians in this area will have to be lent to these hospitals. The government may have to create some of the other medical college hospitals in the periphery for secondary hospitals, and the ICU facilities where the patients go really bad. They may require extracorporeal membrane oxygenation, artificial heart and lung, etc. They may have to be shunted to some of these very capable private ICUs, of which we have plenty here. And another important thing at this time is we have to press our foot on telemedicine. Unless we press our foot on telemedicine, I see with companies like Practo, there is only a jump of 20%. This has to go to maybe 400 or 500%. People are now calling at 3 o'clock in the night, 11 o'clock in the night, and especially the elderlies, people who are above 60, people who have diabetes, people who have lung, kidney, and other problems. We can't allow them to be coming to the hospital and exposing themselves. And they can be very capably monitored, screened on the telemedicine, and only when we are alarmed, we can call them to the hospital. And this way, we will reduce the exposure of the doctors and the medical personnel. We will reduce the crowding, expenditure, and more importantly, the torture to the families. So there are many ways, but I think we have to be extremely positive that, like Italy, we are not going to be needing 300 ICU doctors coming from China. We will surprise the world, but we must be ready for the worst, that we are going to see a lot of cases, and we have to brace for that. Like Karnataka should be the role model that everybody, fatafat at every district place, taluka place, have to create their corona hospitals.
But let me ask Dr. Parker, if Dr. Jalil Parker, what's the level of preparedness within Mumbai, another city, in a big city where we have seen quite a few cases that have emerged. Are we prepared for this?
Over the days that have passed, I think the Maharashtra government has given a very helping hand to most of the institutions, and I've asked all private institutions to help. For example, in my hospital, we already have a core committee which has got junior consultants, clinical assistants, consultants. We also have intensivists, anesthetists, etc. We have made masks ourselves. So I think, there should be a mass production of masks which are not available. People have just, I think, hoarded the mask as much as they can. Secondly, the medicines should be available. As somebody rightly said, we need a couple of ventilators, though we have, but I think the number of ventilators for the population at large, I think they should increase. Also, the testing should either be free or I think the expense for the doing those tests for COVID-19, I think it should be made much more cheaper so that people can, approach the institutes and get themselves tested rather than spreading more and more into the community.
So who should take this burden on, Dr. Chawla? Should we see, can it be the central government? Can it be the state governments? Can it also be private hospitals who take on some of this burden and say, okay, we will help you with the cost of this testing?
If this spreads in the way we are thinking, then we really require very large number of kits, very large number of participation. It can't be only the central government, the state government, and I think the industrialists who have a lot of the money at their disposal, they can participate in this and contribute largely at least to the kits like Reliance and others. This is the time when India needs them. And when you really require, you will require a very large number of kits. As you just heard, they should be available either free of cost or very, very reasonable. Like 4,500 now, the money fixed. Many of the people may still not afford it if they really required the test. But we need to be very cautious, not test indiscriminately, only test who really required, and we have to prioritize and just follow the government directives because they have been based with a lot of discussions. If we start doing for everyone, the kits will finish and the people who really require will not be there. So we need to follow that. And I think everywhere the private-public partnership has to be there. All the state governments are talking to all the corporate hospitals. Like in our hospital also, there's a lot of preparation has already been done to if there is something like this happens, and it is going on. Every day there are meetings. So this has to be a continuous process because the advisory may change every day depending on what is the situation. So we have to be very cautious, very observing for what is changing in the coming days.
Okay, so here is the other question, and a lot of people are confused with this. Dr. Shah, when we say that we should increase the number of testing facilities, what's the point in really doing that if we don't really have enough number of testing kits, which is why we are being extremely cautious about where we use these kits?
So as of today, we have around 5,000 testing kits which have been procured for the government sector. 52 centers all across India and we testing around 5,000. We have 5,000 kits, but as of now, we are not even utilizing that many number of kits. So yes, A is to start utilizing those kits because I mean that stringent criteria which was laid down earlier that only with travel history as well as contact history would be tested. So that days has already gone to people who have been having pneumonia, severe pneumonias on ventilators. They have been tested, but I think we should start picking up early and those moderate cases also. So if we start picking up them, we can follow them up in the community as well, and we can try to do contact tracing and isolate each and every individual. So as of now, if we have 5,000, if we have a government sector as well as the private sector coming in, it would be around 15,000 more kits of those. So around 20,000 kits for the start, I think it should be doable and we can do those many number of cases. But surely we need to test more to identify more number of cases.
Now, so Dr. Shah, where can we get these testing kits? What's the option once we run out of this? Are we making it ourselves? Are we importing it from elsewhere? Why would any other country also want to share those when everybody is going through the same problem?
Yes, absolutely. So as of now, we are importing all those kits as far as I understand. So I think there should be a system where we start developing our own model. So there's a second CAFID model which I'm aware about, which is relatively an easier test that we can do it. The turnaround time, the TAT time is little lesser with that CAFID model, but that model is still not, the cartridges and for the models are still not available. I think if we do some research and if we can just prepone that thing, we can definitely start making it indoor in our country, and probably we'll be able to test many more number of patients for the future purpose.
Okay, so the one part, of course, is the testing aspect. But let's say that now we've got an X number of patients already who have tested positive, who need to be now treated. How do we go about doing that? Now, we've spoken about some of the big cities where governments are preparing. Outside of big cities, Dr. Vivek, it's just extremely scary to even think about it in smaller towns. What will happen?
True. No, as I said, the role model of what is happening in Bangalore, it has to be replicated in district places, taluka places. We have a large number of doctors, nurses, and technicians. We have very well trained people. We have an extremely good capability of online training. In one day, we can train thousands of people online, and we can go on repeatedly training them. There are enough trainers. The task force has to lead. This is a war-like situation. A war is a very fluid situation. And in a fluid situation, the command structure has to be very strict. Nobody's intelligence is required in between. So a task force, clear technocrats leading the war, and we have to be in a hurry to create these facilities. India has a tremendous capacity to produce lots of things. And testing kits, ventilators, we have to now let our industry loose. And I'm very sure with encouragement, support, financing, we don't know what is the depth of this crisis, how long it is going to go. So I think we should start all that. And as I told you, I was proud of my state because what we should have been doing day before yesterday, we at least started yesterday. And everybody has to be in a hurry. And I agree with my last speaker that we have to be extremely stingy. We can't be spendthrift. My senior friends in Italy are crying, telling me that they are like the warriors who have run out of the bullets. And we should not get into that situation. All India Institute has created a fantastic protocol of managing these COVID-19 cases and where you should actually test and where you should think of ventilator. And ventilator there are. Only thing is now somebody has to take the lead. We have to start pooling all our resources. And the public-private partnership, I don't think there is problem at all. Everything, there is a lot of positivity, there is a lot of camaraderie. I think we will be able to fight this. But we have to be in a hurry. We have to be extremely composed and extremely positive. No calling names, no nitpicking, and people have to get that fear that we doctors are having. I was been talking to my non-medical people. Everybody says that you are being an alarmist. क्यों खौफ पैदा कर रहे हो? अरे भाई खौफ जरूरी है. Right now that there's a time for this khawf. And the moment our people are very smart and very street smart, the moment they come to know that this is something to be afraid of, right up to the last jugi, everybody will start falling in line, and then you will see the magic of how Indians can really react in a crisis.
So
let me training, spread the word, and create the fear.
Yes. Let me rephrase this to ask a very direct question, and I'll start with you, Dr. Jolly, and then I'll go across to others. Is absolute lockdown and social distancing our biggest hope, keeping in mind the kind of health infrastructure we have?
Absolute. We have been freaky lucky. All my American friends are telling me that they appreciate that India has been acting in time. Now we cannot let this go. An absolute lockdown, and we will have to then decide how long we do that. But this is one of the important way by which we may reduce the force of that blow. Because if the blow comes with that force, we will be wiped out. This will be a biocorrection for our country.
Okay, let me take that point across to Dr. Chawla. Dr. Chawla, do you think this is our biggest hope right now? Because if we go beyond a certain number of cases, then it might just be a massive burden on the healthcare infrastructure.
Absolutely, because we have limited resources, and in a short period of time you cannot have so many ventilators if it spreads in the community. And I think the lockdown, social distancing, everyone has to participate. It is not only the government, not only the private hospitals. Every individual is a warrior. Everyone has to feel responsible, and don't go out if you are not really required, and isolate yourself. Stand at a distance, because it is not the government job, it is everyone's job. If we have to fight, everyone has to participate. And we should, as I said earlier also, that we should not get panicky. Like if I have a little sneeze or cough and I look for a test. No, just follow the government, quarantine yourself. Whatever it is, it will not spread to others. So everyone has to participate. We should collect our resources like you heard from a gentleman from Karnataka, they have done. So similarly, the government, the private sector, they should find out how much is the resources and how we are going to handle it. And everyone has to participate. As the rush in the hospital has gone down tremendously, I think it is important for all the administrators now to sit down every day and every day during many times during the day and find out that if a patient starts coming, how they're going to be flow, what is the algorithm in their hospital, and create as many beds possible. Even if we don't require, that is our success.
Okay, Dr. Parker, would you want to add to this? And also, again, and we've highlighted this many number of times, but I would request you to one more time highlight this to our viewers. At what point, with their sickness or symptoms, should they go for testing? Often you have instances where just if somebody has one symptom, they've gone running to the hospital, which obviously adds to the burden at the testing center or the hospital.
No, I think once any patient, he feels that he's got a sore throat or he's got a body ache, headache or fever, I think symptomatic treatment for 3-4 days should be fair enough. But if he is not responding to that, I think then he should run to the institute which is nearby to him and which has the facilities. One more thing I would like to add is that we are left with no other option but this isolation and section 144, etc. But in the same breath, I would like to say and stress that we have to be compassionate with the poor people. We need to have certain facilities to be given to them. For example, the bakeries should be open. For example, fruits vendors should be available so that they can sell their fruits. And people who are working in the medical sector, they should be permitted to travel. They can't travel to give in their services. If everything is shut down, how will they reach an hospital and how will they serve the community at large? So I think all these things need to be thought about and executed in the most rational way.
All right, so that's what we need to look at. I just want to also have a follow-up question, Dr. Jalil Balkar. You said that if you have a certain symptoms, there should be a treatment for 3-4 days. What is that treatment, and is that meant to be done at home?
Because usually when you have a viral infection, after all, there are other viruses also. So when you have a viral infection, you take antipyretics, you sometimes take anti-inflammatory, you might take an antibiotic to which you respond. And that's how it should be. Usually the antibiotics do help in the initial course. And if you have, for example, you have cough, then you have cough expectorants, you have cough suppressants, you have oral antibiotics. I think you should give a trial of all these things before you rush to the hospital saying that it is COVID-19.
Thank you so much for reiterating that. Cannot emphasize on this enough, and we do this repeatedly. Tell our viewers that try these things out at home, and only if you have all of these symptoms which refuse to go away should you then approach a hospital for testing. Otherwise, it's just going to become a burden on the testing center and on our entire healthcare system. A big thank you to all of our very, very senior and reputed experts who joined us tonight to help us understand. Now, I'm going to repeat these priorities one more time for you. Add to existing healthcare infrastructure for the next stage. The government, state government, along with private hospitals, need to start working on this right away. Aggressive tracing of super spreaders. There have been cases where one person who's tested positive has in the past few days interacted with 1,000 people, 400 people. We need to trace these people and put them in a lockdown right away. Take strict action against violators to send a tough message to the whole country. This is the most important. And while repeated appeals are actually coming from the government, including the Prime Minister, who's now started using the hashtag stay home and is repeatedly tweeting, asking people to stay home. Some people are still not getting it, and some people don't get the seriousness and the gravity of the situation. Perhaps it is time to start taking tough action, including some netas who disregard the social distancing norms, who are disregarding Section 144, who are disregarding the lockdown that has been brought into place. It has to be done. Let's start penalizing the violators who refuse to join us in this war against coronavirus. And yes, the authorities need to look at expanding testing facilities and perhaps widening the scope of testing as well. Thank you so much for joining us on this conversation. Lots more on the other side. Stay with me. Welcome back. We've now got a special guest joining us, Rohit Dutta. He's a coronavirus survivor who actually traveled abroad and then came back to find out that he had been infected with coronavirus. Rohit Dutta, thank you so much for speaking with us. To begin with, if you can tell us, how did it happen? Where were you traveling and when did you find out that you had been infected?
Ma'am, actually, I had gone to Europe. I had gone to Italy on the 16th of February and came back from Vienna on the 24th. Reached Delhi on the 25th. When I reached Delhi, I on the 25th night I had fever and went to my physician. He gave me medicine that it looks like a little sore throat. It would be okay in a couple of days. 29th, it could not go, so I went to the doctor and requested him that I want to get my corona screening done. He referred me to Ram Manohar Lohia Hospital, and I went to Ram Manohar Lohia Hospital. They admitted me then and there because there was a form which you have to fill, which says that you tell me of the symptoms if you have any. So I clicked on the fever symptom. They were prepared. They told me, Rohit, you'll have to stay over for the night till your reports don't come. Next day, on the 1st of March, I got corona positive, and the hospital authorities and the government authorities came to know of it. But the good part was that they did not disclose it with me. Because night time everybody has a lot of anxiety and it is difficult for everybody to sleep. So they broke it to me on 2nd March morning. A team of doctors came over and they informed me that, Rohit, you are corona positive, and that's it. It got.
What was the first thought you had in your mind?
Trying to.
Mr. Datta, you were one of the first cases we saw here. By now, there's much conversation that's happened about coronavirus and how to deal with it and what to do. But what went on in your mind at that point?
Ma'am, actually, things altogether were different. I was not focusing on myself, what is happening to me, because, ma'am, doctors, when they came to me, they told me, Rohit, see, you are corona positive, and we ensure you that it might take a day or two longer, but we'll send you home hale and hearty. At that time, ma'am, they prepared me for 28 days of isolation because I was the first case of Delhi, and they also were not having what to do. But ma'am, remarkable, they told me that, Rohit, it is just a common cold and cough. It is just that we don't have medicines for that, but we ensure you'll be safe. And I trusted them. Here I am after so many days sitting in front of you, ma'am.
Was any of your family members also then put in quarantine? How did that work out?
Ma'am, actually, as soon as I was tested positive, the team of some doctors, they rushed to my home just to understand how many people are at my home. So they asked my wife that how many people I have met, how many people in my office, so they could arrange everything. Next day morning, ma'am, a couple of teams, ma'am, it was like 3-4 teams. They went to my office. Wherever they found risk, they just brought them to Safdarjung Hospital. They checked my family, told them to stay in home isolation for 14 days, and till the reports don't come. And I had met some friends of mine. All were checked, ma'am. Office staff, families also were checked, ma'am. So when I was told that Rohit, you are corona positive, I was full of guilt that Rohit, you might have infected so many people around you.
Yes, and that's a very
Which
heavy
God's grace,
guilt.
everybody turned out to be negative, ma'am.
That's a very heavy guilt to carry for those 2 weeks,
Yes, ma'am, it
Mr.
is.
Datta. How did you handle it? Because, while we're also talking about the physical treatment and the scientific treatment to the disease, often we don't talk enough about what it does to your own mental peace and the stress it gives to you.
Ma'am, stress was actually, see what happened. Some people on WhatsApp, they just took out my photographs and they started circulating my family photographs. They just started circulating all around India, ma'am. You could see that gave me a lot of stress. But the actual stress was, ma'am, the people I had met and my children had gone to school. So if you see, ma'am, my children, I have two kids, and they went to school. Uh, there were six sections, and a day before, my son had his birthday, and he had given toffees to the entire form where he was studying in all form in his form. Sorry. So, ma'am, it was really bad. But, ma'am, when everybody got tested and all the reports of people I met or my family met were negative, so I think guilt went. Then I started thinking about myself that Rohit, now is the time where you have to focus on yourself. So ma'am, when you generally you would not see a lot of men crying. I also don't cry, but as soon as the negative reports came, I had a flow of tears, and it emptied me, ma'am. I could focus more on than my health. I thanked God that everybody was fine, and just, ma'am, it was a nightmare till all the reports of other people had not come, ma'am. Full of guilt, ma'am. You just cannot imagine, ma'am, what guilt it would have been.
Well, so good to see you today, Mr. Datta, all
And it
smiling
was,
and healthy, and with us, having
thank
this
you.
conversation with
Yeah.
us. So that's
Yeah.
really good to see. How did you survive those those weeks in treatment where you couldn't talk to anybody, you couldn't meet anybody? How did you keep yourself busy?
Ma'am, see, things you have to just. It is like when you are in war, you have to do everything. You On a lighter note, even washing clothes, which I have never done in life, even washing clothes was a time pass. I looked forward, I have to wash clothes, and it will kill my 30 minutes. So things
Would have been
are,
once you're
ma'am.
back home.
You have to just plan your day.
That would have been once you're back home. But were you
Sorry.
treated at the hospital, or were you allowed to go back
No,
home
no.
and stay in home quarantine?
No, no, ma'am. I was at the hospital. I was shifted immediately when the government came to know that I am corona positive. They shifted me from one hospital to Safdarjung Hospital, and I had to stay there up to 14th of March, ma'am. 14 nights I had to spend there until unless my two of my reports did not come negative, and I was a virus-free man for them.
Yes.
So they then gave me back to the society.
Yes. Okay.
Yeah.
And did you get a special welcome back when you got home and met your family then after 2 weeks?
Ma'am, it was, see, I had to undergo another 14 days of home quarantine where I
Quarantine.
have to maintain a distance of at least 1 meter.
Yes.
Quarantine for, I have to maintain a distance of 1 meter. So it was hug from 1 meter away. It was showing in their eyes in form of tears. Ma'am, cannot explain.
Okay. Then, Mr. Datta, let me ask you this question. Now, you are an expert at how to spend time at home
Please.
in a quarantine situation, maintaining distance from everybody. Give some advice and tips to our viewers. Now, everybody is in a
Yes, ma'am.
lockdown in all big cities, wondering what to do.
Ma'am, see, honestly, hospital 5 days they taught me everything. It is just planning what you need to do. You have to just jot it down in your mind. Uh, Ma'am, see, I am a little busy now because I'm getting a lot of calls. But see, movies help, ma'am. Carom board helps. games like Ludo, which people have stopped playing, they help. Yoga helps. So, ma'am,
Yes.
there are many things, ma'am, which we all were missing in our lives, ma'am. Family time, ma'am.
Yeah.
We all book tickets for anywhere in the world for traveling, and there also we just don't sit, relax. We just go and have, chalo Disney World chale jate hai, we go there and that. But, ma'am, this time, I think, although it is a pandemic, but home time, quality time has come.
Yes.
I have not seen this for last 30 years.
Oh, yes, and I think especially in the last few years when we've all gotten so caught up in social media and digital media, this is a
Yes,
very,
ma'am.
very different era now we are looking
Correct,
at.
ma'am.
Mr. Datta, was there a time when you were in hospital, your family members and everybody else who had been in touch with you, they were in quarantine as well? Was there some kind of a, backlash or negative vibes that you got from the society, from people around you? Right now, we're getting a lot of reports. I ask you this question because we're getting a lot of reports of, for example, the crew that is traveling in flights, they are being ostracized from their society. Anybody who's come from abroad, has done their 2 weeks of quarantine, is still getting ostracized from their society. Did you face anything like this?
Ma'am, actually, I was in hospital, honestly. So, but of course, my family faced because, ma'am, I was the first in Delhi. People were really, it looked like I am a criminal and I have done some crime. But, ma'am, the good thing was my immediate neighbors, people who stay one floor above my home, which we've been staying for 15 years, they were together, even in bad times. But, ma'am, you find all sort of people. You cannot help them. It is not a social stigma, ma'am. It can happen to anybody. Nobody goes and purchases corona.
Yes, yes, absolutely. In fact, we have started a campaign to tell people that this is
Ma'am,
not a social stigma and people shouldn't be punished or ostracized just for the fear कि अरे देखो उसके हाथ में स्टैम्प है वो क्यों हमारी सोसाइटी में है उसको क्यों रहने दे रहे हैं.
correct, ma'am. And ma'am, see this thing, ma'am. We are focusing not on the not on the bigger picture, ma'am. See, lockdowns are very helpful, ma'am. We should see what difficulties the government and patients are facing in hospitals. If they are facing any, we should focus our things on them, ma'am. Like I know, ma'am. Today everything is locked down. We are of no help to the government. But, ma'am, this is the time where we all should cumulatively come forward and look after each other without meeting them, of course. But if anybody needs anything, neighbors should come out and help, ma'am. That is what society living is, ma'am.
Yes, absolutely, Mr. Datta, absolutely. One advice that you would give to people, even now, if you've seen some visuals of people, defying the quarantine or getting together out on the streets, even on the day of, yesterday we saw at 5 p.m. there were people who were gathering in the society and celebrating. What would your advice be to India right now from a man who got infected, who was treated, who got quarantined, who fought it all and is now back? What your advice will be?
Ma'am, just maintain quarantine, just maintain isolation. That is the only way out, ma'am. And don't ever think it cannot happen to you. It can happen to anybody. If it has happened to me, it can happen to anybody. Ma'am, just maintain social distancing. It is the most important thing. And, ma'am, see, we've been seeing now, doctors are saying, ma'am, China is now on the verge of no cases at all. South Korea has improved, Japan has improved. Ma'am, I think it is commendable that even now we are less than 500 people. That is just hard work of what the ministry and the other people are doing for us, ma'am.
Yes.
We just need to maintain what government is saying. I also saw yesterday, ma'am, I am limited to 2-3 windows in my room.
Yes.
I also see senior citizen moving out, ma'am.
Yeah.
Children are playing in the parks, ma'am. This is utter foolishness, ma'am. They need to understand it can happen to anybody. It is a flu, and once you catch that virus, your 28 days of your life are gone.
28 days of your life are gone, and like you said, you had to deal with the guilt until each of your friends and family members are tested negative, you have that, fear in your head that because of you, you may have given it to others. That also everybody has to keep in mind, that you may not know it today,
Yes,
but
ma'am.
if you travel and tomorrow somebody
Ma'am.
else catches it because of you, then what do you do? Thank you so much, Mr. Rohit Dutta.
Yes, ma'am.
And it's really great to see you back.
Thank you, ma'am.
And thank you for your sharing your experience with us. I hope people
Thank you,
learn
ma'am.
from your experience as well, and ensure that we all get into this fight together. Stay
Thank you,
home
ma'am.
and fight coronavirus. Thank you so much. Well, we're going to take a very short break. Lots more on the other side. Stay with us.